Welcome to the Holistic Psychiatry Podcast. I'm Courtney Brown Snyder, a physician and holistic adult and child psychiatrist. Recently, I had the pleasure of being on the Nourished By Nature Mind Body Wellness podcast with Annika Taylor, a holistic and functional health practitioner. Annika invited me on to discuss the Walsh nutrient imbalances, so high copper, low zinc, Pyrrole disorder, methylation imbalances, with a focus on undermethylation, and how these different imbalances can contribute to anxiety and depression.
Welcome to the Nourished by Nature podcast, where we geek out on all things holistic health and mental wellness. I'm your host, Annika Taylor. I am a functional health practitioner and the owner of Nourished by Nature Wellness, a health practice dedicated to bringing women natural solutions for vibrant mood and gut health. Today we have Dr. Courtney Snyder, who is a physician and a holistic, functional, and environmental psychiatrist. She treats children and adults in her telehealth practice, and she also educates on the science behind her holistic psychiatry training. She brings a balanced approach to healing and uses her blog and podcast as a way to bring hope to those with brain-related symptoms. And a very, very warm welcome to you today, Dr. Courtney. Thank you so much for being here.
Thank you. Thank you for inviting me.
Oh, I'm so happy to have you here. And I'm really excited today there's so many, we were talking before we hit record, but there's so many subjects and so many things that we could talk about today. But I kind of wanted to focus on, the work that you do with your clients, with your patients, and really coming at the symptoms of anxiety and depression and different, mental imbalances that we experience, but from that holistic point of view, which is what you do. What really brought you to where you are today? And what was that journey like for you? What made you, decide to be a holistic psychiatrist?
I was certainly conventionally trained in adult and child psychiatry, and my practice originally was providing psychotherapy for adults and children and prescribing medication when indicated. So I already wasn't doing a typical, kind of med check practice that a lot of psychiatrists primarily do these days. And I subspecialized in treating children that had early attachment related issues. So they might have been adopted from international orphanages or through foster care. And from there, when my daughter was born, I decided to stay home. When she was around 3, she and I both started to become sick. She was starting to regress, and that had me concerned, even that she was having regression into autism, what we would call regressive autism.
Right. Okay.
Developing fine and then starting to regress. And I was starting to have chronic fatigue, a lot of pain symptoms. And that led me, especially her health issues, because there seemed to be a sense of urgency about it, into looking online and trying to find answers. And that took me down the dietary path, candida overgrowth, and learning about how that could be at play. And really changing the diet for both of us, there was benefit. Not complete. Really, we were both sick for a period of 10 years before I returned to psychiatry. And when I did, it was with bringing dietary interventions, a lot of research into the microbiome. And then I trained with the Walsh Research Institute, which we'll talk about. And then found that to be quite powerful and impactful for many people. But because of my own health problems persisting in my daughters, that pushed me further into functional medicine and realizing that what we actually both had was mold toxicity. And this was back in 2017 when we were both diagnosed. So it was still early on the forefront, hadn't really gotten into functional medicine the way it is today. And that's when I started treating people for that and more complex chronic illness. And then only later to discover that we also had EMF sensitivity, which a lot of people with mold toxicity get. So it's really been through personal experience that I've expanded my understanding. So a lot of people I see do have main psychiatric type of diagnoses, but also a number of people with complex chronic illness with a lot of psychiatric symptoms. So I hope that wasn't too long, but that's the.
Oh, that's amazing. I honestly, I think that is really what shapes us as practitioners, certainly as humans, is going through something like that, and then really, really from a deep understanding, being able to have that compassion for those people that you're working with now and you've walked it. I just think that's incredible. Also, there's something really to be said about working with a family member also, or a loved one that's going through
Yeah.
something,
Hmm.
and doing all of the hours and hours of research to figure out how to help them. And it can be exhausting, but seeing that, now I see you on the other side of that and how much knowledge you've gained and how you can, like I said, just with the compassion with your own patients, I think that's incredible.
Absolutely. I mean, it does give a different kind of fuel of purpose,
Mm-hmm.
that when you've been through suffering to then want to relieve that in others. And in my
Yes.
case, for mothers and parents, with a struggling child, and then also for people dealing with, I mean, and I should say I was quite anxious at the time, which is not uncommon with chronic fatigue and fibromyalgia.
Oh yeah. Yeah, and it's usually not just one symptom, it's going to be all of those meshed together, and that's a
Right.
lot to go through. So going through that, you came out of that, and I'm assuming that had a lot to do, like you said, with going more of the holistic route in the psychiatry rather than the quote unquote regular
Right.
psychiatry. Would you mind telling me a little bit about really what is holistic psychiatry,
Yeah.
especially versus what we might traditionally think of what that would be?
Sure, sure. And I chose that term early on, and I at the time sort of felt like, oh, this is not fitting. My instinct was this is the term I wanted to use, and I've actually
Yeah.
more grown into it because
Oh,
I
I love
was
that.
more steeped in the science piece and really through my own process realized how even harmful that singular approach can be,
Hmm.
because it can be quite stressful to be managing the details of labs and nutrients and environmental exposure.
Oh, sure.
So for me, holistic, people can define it really how they want because there's so much evolution in this. For
Mm.
me, it's functional medicine, but bringing in more of this right brain perspective of, a lot of like the information that you share about how to lower the stress response, how
Hmm.
to access the vagus, how to be more grounded, and really trying to balance
Mm.
both pieces. So I consider functional medicine quite technical. I consider integrative to be more lifestyle. And for me, holistic are those. And like I said, bringing in more of the spirit inner experience.
Have there been studies, scientific studies or doctors studying the just kind of the percentage of people with, say, depression or anxiety, and just figuring out, like, have they figured out what are the most common causes on a physical or a biochemical standpoint? I was wondering if you could walk us through a little bit of that.
There's the data that we have, and then I would say that's within a larger context. So when I think about root causes, I definitely think about the nutrient imbalances,
Hmm.
which we do have, I would say, good data on, and I'll talk about that. But that doesn't account for things like mold toxicity, EMF sensitivity, um, even, gut microbiome issues, candida overgrowth,
Mm.
things like Lyme, co-infections. Not that I see those as commonly as I do candida, mold, and nutrient imbalances,
Okay.
but there's also structural issues of the head and neck that can be impacting people, mast cell
Right.
activation, autoimmune conditions like PANS or PANDAS.
Right.
Um, so there's a lot of things that can be at play, and so nobody is researching those. I mean, I kind of see my job is to pull together these different schools of thought and see
Right.
where the dots connect. But where we do have good data and that would be impacting most people with brain symptoms is when it comes to the nutrient imbalances.
Okay.
And this is comes out of the Walsh Research Institute and Dr. William Walsh, who with colleagues looked at 30,000 people. I want to say it was over 40 years, and
30,000 people. I want to highlight
30,000
that.
people
That's a
with
lot.
brain with brain related symptoms. So the whole
Okay.
range from autism spectrum, ADHD,
Mm.
anxiety, depression, schizophrenia, bipolar disorder, dementia, and looked at nutrient levels, many nutrient levels, as many as they could, mostly in the blood, but also urine and hair. And they found that there was just a small handful of imbalances that were repeatedly showing up, irregardless of the diagnoses. They were able to then pull out for each diagnosis a percentages of the imbalances. And so those are the nutrient levels that I would check on anybody. And they're actually nutrient levels that anyone can check. These can be ordered. People can order these, and we can talk about that at the end on their own.
Oh, goody.
But they include copper-zinc imbalances, which are usually low zinc. The Walsh Research Institute found that 90% of people that had brain symptoms had low zinc. Now, this is relatively low.
Wow.
I could talk for a week about zinc and
Yeah.
how underrated it is. It's so incredible.
Oh,
What a
wow.
big player. The range that we use is a tighter range. So if a typical lab range might be quite large, it might be like 65 to 135, but we would consider optimal the higher end of that range. And what they were finding was that people that had brain symptoms were falling either low or relatively low. Do you know what I mean? So they found an
Yeah.
optimal range that is what we aim for. And then high
Okay.
copper is another, or a copper zinc imbalance. If copper's relatively high compared to zinc, we aim for a 1-to-1 ratio on that.
Oh, okay.
They found that 68% of people with ADHD actually had a copper zinc imbalance. So again,
68. Wow.
68%.
So
Yeah.
90% of people they were finding with brain imbalances that they were studying and taking samples of were low, relatively low in zinc.
Right.
And then 68% were having copper zinc imbalances.
68% of people that had been diagnosed with ADHD,
Got
children or
it.
adults, had
Got
copper
it.
zinc imbalances. That's
Okay.
right.
That's
Yeah.
so significant though. Wow.
Right. And
Okay.
another one that stands out is 94% of those diagnosed with postpartum depression or anxiety had high copper. And we
Mhm.
see high copper in other situations, but that when someone has had postpartum depression or anxiety, we already suspect that's going to be a given.
High
Um,
copper.
yeah.
And that
So
one,
oh, go ahead.
oh, I get kind of excited about that one because we kind of think of postpartum depression as this sort of mystical, like we don't really understand why it happens, and women don't feel supported, and might feel like, really just, judged afterwards. But I know that the copper plays such a big role, and I mean, this information should be out there for everyone because this
I
is a
know.
really big issue.
That's why we're doing this.
That's why we're here. All right. I get so excited. I interrupted you, but please.
No, but that's important because there's a relationship with estrogen. Also, copper IUDs
Mm,
and birth control can make copper levels go up. So when a woman has a new onset of symptoms, depression, anxiety, brain fog, insomnia, after starting on birth control, the likelihood is their copper has gone up. It may not happen right
right.
away, but it takes,
Yeah.
it could evolve and they might not realize it's the birth control.
I see that in my own practice for sure. And then as far as, after pregnancy, the copper is so high. Remind me why the copper gets so high. I listened to this podcast that you did, but I can't
Sure,
remember.
sure. It promotes vascularization, which is needed for the placenta to sort of have a
Right.
blood supply for the baby,
Okay. Yeah.
provide nutrients. So copper naturally goes up during pregnancy, but
Right.
it should go down after. But if someone has a genetic vulnerability towards copper overload, they could actually each pregnancy become higher and higher,
Oh, with each one.
potentially.
Okay. Yeah. That's,
Because if they're not able to regulate it, to bring it
yeah.
back down.
Oh, that's fascinating. Okay.
But, there's a lot of individual variables, so that doesn't mean that
Sure.
that would be the case for everyone.
For everyone. Yeah.
Copper, zinc imbalances, and then the other is pyrrole disorder, which pyrrole, I'll just say briefly, they're a metabolic waste product. They leave the body through the urine, and when they're high in the urine, people are low in zinc and B6, both of
Mm,
which are really important for brain health. Each of these things has its own sort of characteristics, but the hallmark there is low stress tolerance, avoiding stress because of low stress tolerance, kind of this global sensitivity, maybe shyness. And then there's all of these things have sort of distinct traits and features. I know we'll focus on methylation, but if any of these are fitting for anyone listening, they can
Yeah.
find resources.
Oh, like your podcast, my goodness. It's all right there.
Or yeah, thank you. I mean, if they just Google Pyrroles, they'll probably find some out there. But yes,
Yeah.
I do have on my website a list of symptoms under the Pyrrole blog.
Yeah, and you explained it really well. It's actually something that I learned about years ago. And I'm happy to spend a little bit more time on it today because nobody's talking about this. Even in the holistic health world, this is fairly new. I'm in a program and they're only just now teaching us how to read these labs, and I'm so, so thrilled about that.
Oh,
But
good.
the pyrrole disorder is something that I think so many of us are walking around struggling with, and we don't understand that, there's a relatively easy support as far as zinc and B6, once we get tested and can confirm that's what's going on. I just think it's fascinating because if you've got that condition going on, like that could be the main reason that you're struggling with mood imbalances, with so many different things. So yeah, that's an important one.
Right. And it is the one, I mean, we'll talk about treatment, but it is one where we see pretty quick dramatic
Mm.
responses to the treatment. So it's particularly satisfying because people do respond right away. Sometimes we can't start too much zinc too quickly because copper could be high and it could
Yeah.
mobilize copper. Otherwise, it's just really provides a lot of relief usually for people.
That's great. And now I think our audience is probably dying of curiosity. What are some of the symptoms of having this issue?
So Pyrroles, again, low stress tolerance, avoiding stress because of low stress tolerance, maybe uncomfortable in crowds, new situations,
Mm,
maybe a tendency towards being shy. But there's other symptoms like mood swings. Social anxiety is fitting with what I said, but
right.
it is one of the biotypes for depression. Then there's some interesting things like tendency to stay up late. So then person that's kind of a night owl, or then
Mhm.
to delay and skip breakfast because not having an appetite in the morning. It could be not having good dream recall. That's related to a B6 deficiency.
Mm,
But there can also be some connective tissue symptoms like skin-related symptoms, stretch marks.
and
There can
stretch
be
marks, yeah.
there can be a tendency towards autoimmunity, infections. I should have said there can be a tendency towards learning issues or lack of motivation. I find some people dealing with this, they're not able, while they're dealing with this, to kind of meet their potential.
Right.
They're just kind
Yeah.
of held back even with many great gifts because of that low stress tolerance.
Yeah. Oh, and that describes, I think that describes all of us when we are going through something like stress, anxiety, or depression, right? It's like we are held back from the being that
Mhm.
beautiful human that we were created to be because this is, yeah, totally a boulder in the road. And we're just trying to survive.
Right.
Um, so wow, yeah, I could do a whole podcast with you about the pylorrhea, but I
We can do that. One last thing related to what you just said, though, is that pyrroles do go up when we're under stress. So that could be emotional
um,
stress. It could be an underlying illness. It could be something like mold toxicity or candida overgrowth. But it could be a growth spurt. It could be starting a new job. Then pyrroles go up and then these nutrients come down. So it really affects resiliency.
okay,
And it can have people kind of on this big plans, high stress, and then not being able to carry out what they wanted to do.
gotcha. So I would love to kind of go over how you use the Walsh protocol, kind of what that is,
Mhm.
and kind of start that conversation with Dr. Walsh's biotypes for depression. So I'll go ahead and read these actually. So Dr. Walsh, when he was doing those studies that we were talking about with the thousands of people and testing them and figuring out, okay, he could kind of put people in the pie chart of percentages of what was the most common thing with, let's just take depression.
Mhm.
So when we talk about depression, he found that 38% of the thousands of people he was testing, they were suffering with undermethylation, or they had a undermethylating system. And so that was, I mean, that's a huge chunk, 38%. And then 20% is folate deficiency. And again, this is all the umbrella of people with depressive symptoms.
Right.
17% was copper overload, which we had just kind of talked a little bit about copper and how that really disrupts the nervous system. And we get it from all sources. We can get it from copper pipes to our home, like you mentioned, birth control. And so that's 17%. Pyrrole disorder was 15%. And then toxins and toxicities was 5% of people that he was testing. And then the other was 5% of just other things that it could be. But I think it's interesting that a huge chunk of that has to do with methylation. And so,
Yes.
yeah, I would love to talk about that and kind of go over
Sure.
how you treat that.
I'm glad to talk too about the traits of undermethylation and what, if you'd like me to comment briefly
Yeah.
on methylate, what it is.
Let's do that because yeah, it's a big buzzword in the holistic health field,
Right.
but really understanding what it is and why it should be important to us when we're talking about holistic mental health, I think that'd be really good to get into.
Okay. And in terms of how this fits, you were asking about into the Walsh protocols. When we check, we're checking copper and zinc levels, a protein that binds copper that helps with those calculations. So, and then pyrroles, and then we use a whole blood histamine to assess methylation.
Mhm.
And those really are how we assess what was found in these studies. I mean, we do look at basic labs, but it's pretty small and practical. But methylation is it's a process going on at a cellular level in which methyl is generated, and this is a compound that is basically put on different molecules, including DNA.
Mhm.
And that process of something being methylated changes the action of that molecule. And so we want it to be optimal. If we're undermethylated, that can affect the many processes that methylation plays a role in. But one of the most important is epigenetics. So that methyl group being attached to DNA is what turns genes on and off. And
Mhm.
so methylation is important for our epigenetic expression. It's important for the breakdown of histamine. So when people are undermethylated, they actually tend to have allergies and usually respond well to antihistamines. The treatments we use often will help with those symptoms as well. Methylation is partly how glutathione is made, and methylation is important for detoxification. And so all those things actually can affect the brain in various ways. But in terms of neurotransmitters specifically, if people are undermethylated, that will lead to low serotonin activity, usually. About 70% of people that have brain-related symptoms, so within that Walsh 30,000 database, 70% had a methylation imbalance. Most of those individuals were undermethylated. Some were overmethylated. So when you're referring to the folate deficiency, that's actually another term for that is overmethylation.
Okay.
And what he's found over time is that we actually have more and more undermethylated people, which is interesting, and fewer overmethylated people. But
Yeah.
nonetheless, the way serotonin activity is lowered is through an epigenetic phenomenon that has to do with the expression of serotonin reuptake receptors.
Okay.
So that, antidepressants like SSRIs, things like Zoloft, Paxil, Prozac, those are serotonin reuptake inhibitors. The nutrients that we use to affect this, they function similarly, but they're not medication. But not everyone that's undermethylated has brain-related symptoms, but it definitely raises one's vulnerability.
Mhm.
And part of these methylation cycles relate, and I think one of the questions that you had mentioned to me was MTHFR, because people have heard about MTHFR. So that
Mhm.
is one of the main genes in methylation. So if it's has a variant or is weak, that could impair someone's methylation. But there are many, many other genes beyond MTHFR that could offset that. So having MTHFR is not that uncommon. I want to say it's like 40% in the population here. And not everybody that has that is undermethylated. So people can feel somehow doomed, and that shouldn't be shouldn't be the
Right,
case. And we
exactly.
don't even know if a gene's being expressed or not. But
Right.
these are more about vulnerabilities. Often we can tell if someone's undermethylated even before testing because the symptoms are striking. And I'm undermethylated. I would say most physicians are, most people that are,
Me.
okay. Most people that tend to details. Keep in mind, it's not pathologic, but it raises one's vulnerabilities, and with it comes strengths, just like anything else that we talk about.
Mm-hmm.
Obsessive compulsive tendencies. So this doesn't have to be OCD, being ritualistic, perfectionistic. There could be dietary inflexibility. People that are undermethylated do tend to be thin. Not always, but usually there can be a calm demeanor but still inner tension. So
Mm-hmm.
relative to copper, where there could be high anxiety, or pyrroles, where there could be a little bit of social anxiety, this is more of an internal anxiety that people wouldn't recognize. Someone can seem pretty
Yeah.
chilled out.
Mm-hmm.
And it could be ruminations. I think of it like getting stuck in the details sometimes. So there can be addictive tendencies as
Mm-hmm.
well, just like OCD tendencies. Do you know what I mean? They're like getting stuck in that left brain kind of
Definitely.
thinking,
Yeah.
which again can serve us in some ways if we can toggle it with bigger picture thinking.
Mm-hmm.
High accomplishment or high accomplishment within one's family. I mentioned allergies. And then usually people will respond well to antihistamines. And if someone is going to be on medication, they tend to do well on SSRIs for the reasons I mentioned. Whereas people that have high copper and high pyrroles, especially high copper, they don't necessarily respond to SSRIs. And people with overmethylation would actually get worse.
It's important for people to know, but doctors aren't testing that before they put you on something like that, which is frustrating.
Right, right. And so, I mean, people that are overmethylated do have a different quality. They're usually more socially engaged and friendly and your good neighbor. And
Mhm.
um, they might have high anxiety. They might talk rapidly or talk a lot. And they might have a lot of restlessness because they have more neurotransmitter activity as opposed to low serotonin, for example. Does that?
Mm-hmm. That makes a lot of sense. So when we're undermethylating, we're gonna be tending towards low serotonin um, output, and then opposite with overmethylating is too much.
And the other neurotransmitter piece that has come to light in more recent years is high activity at the NMDA receptor. And so it
Mm.
might not be, I don't believe Dr. Walsh talks about it in Nutrient Power, which is the book where he summarizes and expands on obviously some of what we're talking about. But the NMDA receptor relates to memory extinction. So
No.
that if we have high activity there, that is what can be contributing to OCD symptoms, addiction, ruminations. If someone has trauma, it could be flashbacks, these
Yeah.
thoughts that we're getting stuck on, or that are intruding. And
Right.
so now, as part of the protocol, we actually use NAC. I can talk about other parts of the protocol to
Mm.
lower activity for people that are having those types of symptoms. And that's where a lot of medication research is going too, is really looking at this NMDA receptor and how important it is.
That's so interesting. Gosh, wow. It sounds too like when we're talking about undermethylation, obviously you could be anxious or you could be depressed or you could be both. I mean, it's really that
Yes.
stress and trauma response kind of doing that roller coaster, but you're going to be more sensitive, like you said, more prone. Especially, and now I'm just thinking about myself and my clients, especially like
Hmm.
if something does happen, if you do have, chronic stress or chronic trauma or, traumatic experiences, that can also like kind of just push you into that and kind of
Right.
open that up. And so you might be one of those people that, yeah, you are dealing with, I'm just an anxious person, or gosh, I just get really low mood sometimes, but I think it's so valuable to
Hmm.
do this, like you said, the simple testing. We're looking at your histamine, and a couple other things and symptoms, but like really figuring out, no, like what is it for you as a unique person? It's not going to be the
Right.
same for everyone. And I think that's where my frustration is as far as like I said, quote unquote, regular psychiatry, or even just going to the doctor. And because now doctors are prescribing things like this, just your regular family doctor, you can go and be like, hey, can I have an antidepressant or anti-anxiety?
Yeah.
But which is fine, but not actually taking the time to look at you as an individual. That's where I get frustrated because I think we're doing more harm than good most of the time if we're not looking at you as an individual. And okay, we can take a band-aid approach for a little bit to help you feel better, but really what's going on? And we don't want to treat
Right.
you, in a contraindicated way for your specific biotype.
Right. Who knows how long this will be? They say it's 20 years is the delay on
Well,
what's
hasn't it been
happening in
like,
research and when it gets to, because it has to get to medical schools, to doctors' offices, to patient care. And
right? Well, but didn't Dr. Walsh figure this all out like in the, correct me if I'm wrong, I'm thinking like 80s is when he started doing
right.
the,
And he started teaching here in the US because he was training physicians in other parts of the world. He started training in 2014. And so that was the first time I did the training. And then his goal was to train 1,000 physicians in the world in
mm,
these approaches. And he's now surpassed that, fortunately.
good.
But his hope was that, if each physician saw so many people, then this information would get disseminated and then people would lead their doctors
Yes,
into learning
yes.
about this. So yes, it's certainly now made headway, but not yet into mainstream. Even without labs, we can almost figure out a little bit what someone probably has going on. And we look at symptoms in labs together. For example, if someone didn't have high pyrroles, but they have a whole plethora of pyrrole symptoms, I would still opt for treating them. So it's
Mhm.
it's weighing all the information.
I love
And
that.
and two, you brought up, which I didn't highlight enough, that depression, you know, this is the most common biotype of depression. So when people are undermethylated, they can have a persistent and severe depression. Whereas pyrroles, it can be more in and out of depression. This
Mm.
this can be more persistent. And usually people that are undermethylated have that tendency from the get-go. When you ask their history, even as a child, they might have had things that might point, not necessarily depression, but maybe being perfectionistic or
Mhm.
so.
Yeah. Yeah, and wow, I just think probably everyone listening is thinking of either themselves or someone they know that they're like, oh, this could
Yeah.
be this person's,
Right, a lot of
thing.
people.
Um, yeah, I think,
And a lot of people interested in exactly what you and I do because they're kind of deep divers into information and
yeah, and well, like from personal experience, like I said, I dedicated all of my 20s, I'm 31 now, to figuring out holistic mental
Mhm.
wellness because I just saw this huge gap between, you know,
Yeah.
it's such a huge gap in the medical field of like, yeah, but no, but like let's figure out actually. And so many holistic doctors have brought forward like so many options. But the thing that I really, really liked about Dr. Walsh's book and his
Mhm.
protocols is that it felt like it kind of took the guesswork out in a way where we're just like honing straight in. And the fact that he had
Right.
done thousands of case studies and he had such good results and he was able to help us figure out, like when you just hear the phrase, oh, 38% of people, with
Right.
depression most likely under methylating, like that is a gold mine of information. Like just with
Mhm.
that, we can do so much good. And would you mind talking us through a little bit of how you as a Walsh practitioner, how you're using kind of his protocol and kind of the
Sure.
steps with clients or patients?
Sure. The testing is blood work, and then the Pyrrole test is a urine test. Even though I consider other areas that I mentioned earlier, I test these on everyone that I see. And people that are coming to me inevitably, they have brain symptoms because I'm a psychiatrist. then normally people have more than one imbalance. So that's worth mentioning too.
Mm-hmm.
It's not necessarily one or the other. It
Oh,
can
yeah.
be someone could have a copper-zinc imbalance because their zinc's low from high pyrroles and just happen to have a methylation imbalance too. So someone could have all these going on. And then based on the looking at someone's symptoms and their labs, we use the whole blood histamine for methylation. And then the treatment is putting together a nutrient protocol. So in the case of undermethylation, we're using primarily either SAMe and or methionine. I often use SAMe, except not in children. We would be avoiding folate usually in people with depression and anxiety that are undermethylated, because that would further lower serotonin activity. So
Yes.
multivitamins, B complex, the vegetarian diet with all the leafy greens, not that people have to avoid those like a food allergy, but an
Mm-hmm.
overload of folate is going to potentially make someone more rigid and inflexible in their thinking, more ruminations potentially, more depression, or even an apathy. It doesn't have to be
Mm-hmm.
sadness, but an apathy. Um,
Okay. Okay.
so it's part about avoiding excessive folate or enriched cereals or bread. There's folate added there. But then again, the primary nutrients, SAMe or methionine, calcium, magnesium. We use antioxidants. And then again, I use NAC if somebody has that seeming high activity at the NMDA receptor,
Mm.
whether that be OCD or addictive tendencies.
Okay. Wow. And I mean, it just sounds like a bunch of, these are supplements that are, natural supplements. And I love the
Yes.
idea of we're starting here. We're going to support your body. We're going to meet your body where it's at.
Mhm.
I'm curious, do you have, and I'm kind of putting you on the spot here, but do you have a favorite patient success story that you've experienced over the years?
Oh, gosh. Well, I mean, people that have schizophrenia, that can be quite dramatic because their symptoms are, you know, very severe. And
Hmm.
most people with schizophrenia at this point, because it's evolved over time, have undermethylation
Mm.
and or high pyrroles. They could have high copper too, but it used to be more overmethylation. Now it's undermethylation. So that's
Okay.
quite satisfying. Um,
Wow.
I can tell you just my own personal story a little bit on that, just
Oh,
because
yes.
it brings up that not everyone's going to tolerate SAMe or
Mm.
even methionine. And when I had mold toxicity, I didn't. It made me feel pretty bad. And I see a lot of people that they don't tolerate it if they're dealing with candida or mold. But then once I was farther along in that process, then it was just, for me, it was just really impactful. Not, and I didn't have so much sadness, but I could have an apathy or
Yeah.
ruminations about my health.
Yeah.
Um, and also brain fog I struggled with from high histamine levels related to
Mm.
mold. And I didn't have to be all the way through that process, but there was definitely a difference in the timing of it in the case of someone dealing with complex, chronic complex illness as opposed to just straightforward depression or anxiety.
Right. Right. Right.
Um,
That's amazing. I just love that it's something that you've seen results with yourself. And then of course that makes you just such a believer in it and able to really recommend this to your patients. And I'm assuming just, you know, people coming to you, are they coming to you to really for the psychiatrist part, or are they coming to you for like the functional medicine part and they know that you take a very different approach than any other psychiatrist that they've seen?
Most of the people that are coming to me have already started down their own path and want to meet with me to help them identify root causes and start to address those.
Mm-hmm.
Sometimes I'll have somebody come and they want to avoid meds, but they're not at all familiar. And so I try to meet people where they're at.
Mm-hmm.
Um, yeah, I think as you said earlier too, this demystifying what's going on, I think people feel more empowered and the stigma with mental illness fades, when they're empowered with just information and education. So that is a big part of what I do here. And
that's beautiful. I mean, you hit the nail on the head when you said the empowerment, because it does take away the stigma. If I'm told, oh, you have anxiety and you have depression, and that's just how it is, and you can go on this medication or you can do some talk therapy, but it makes me feel like there's something really wrong with me. And when you speak with someone like you, who's like, okay, well, let's look at what's going on. Well, it makes so much sense that you're feeling anxious because you have high copper or you're undermethylating. It makes so much
right,
sense that your moods are
right.
not good. You're feeling crappy and fatigued and all these things. And like you mentioned, of course, there's going to be, the gut microbiome, or we didn't even talk about that, but the gut brain connection is huge. So there's so many things. And that's why I'm just on fire for holistic mental wellness and all the things that we can
Yes.
actually do. And I think the biggest part is that hope that people get. It gives me hope just knowing, like, you know what, this isn't just the end of the road for us. Yeah. So where can
So
people find you?
sure. My website, CourtneySnyderMD.com, has links to my newsletter, which is on Substack. And then I have a YouTube and podcast that sort of come out of my newsletter each week. And then on Substack, I have a paid newsletter also.
Oh,
So
perfect. Oh, yeah. And you guys, please listen to her podcast. Go to find her on YouTube and her blog. It's just a wealth of information if you want to learn
thank
more
you.
about this and understand methylation better, understand, natural approaches to anxiety and depression. I'm wondering if you could leave our audience with one thing, what would you want them to know about mental wellness, about their journey? What's something that you would like to just to let them know and leave them with?
To me, all this information is so hopeful. So that's mostly what I always want people to gain from the education is there's so much that we know now that people don't know about yet. It's just not disseminated enough, and so many things that
Mm,
we're still learning. So I think that there's always hope, even if someone else is carrying it for us.
mm,
And I would add to that, on these imbalances, I test them in everyone that I see. They're out of range in 95% of people that I test. So it's not, will these show up? The expectation when someone has brain symptoms is that they will. More the
right,
question becomes, are there other things going on as well?
right.
So
That makes a
anyway.
lot of sense. Mental wellness is the top thing I think that people are struggling with, especially the past couple
Mhm.
years.
Yeah.
And so, yeah, we just can't get enough of this information out to enough people, in my opinion. So,
Mhm.
thank you again so much for chatting today. I would love to have you back on because I feel like we really only touched the tip of the iceberg today.
Glad to.
So awesome. Then we'll make that happen. Well, you have a wonderful rest of your weekend, and we will talk soon.
You too. Thanks so much. Appreciate it. If you'd like to receive these newsletters in your mailbox each week, please consider subscribing at CourtneySnyderMD.com, where I also have information on my consultations that I offer nationally and internationally. Until next time, take care. Bye-bye.